Hi, my name's Elizabeth Wellspeak. Today I would like to talk about DNRs and how we can be sure that we are respecting our patients' wishes by being aware of their DNR status. I would like to start by telling the story of a boy named Jack Attic. He was a 6-year-old child that went into cardiac arrest at a hospital in England, Leicester Royal Infirmary. He died when the staff taking care of him were stopped from resuscitating him because the doctor in charge of the code stated that he was a DNR. However, this boy was not a DNR. The doctor had mixed up this patient with another patient. This was a tragic incident which could have been avoided. The question is, how do we avoid this error? The issue with DNR status can also go the other way as well. In my facility, I have been witness to a patient being resuscitated when they were a DNR because of staff that was uneducated about the patient's wishes. I believe that this can be avoided within my hospital. According to the Patient Safety Network, this event should be considered a sentinel event. Also, the Patient Safety Network states that the error of resuscitating a patient because healthcare providers were unaware of his code status reflects inadequate communication and coordination of care. They recommend the use of a bracelet to identify the patient's DNR status and the inclusion of communicating code status clearly during report. Within my facility, we do use special stickers which we place on the patient's medical bracelet to indicate that they are a DNR. We also include code status in our shift report. However, if the RN forgets to put the sticker on the patient or communicate the code status of the patient, then there is no double check to be sure that the bracelet is marked. I know from participating in codes that time is short and interventions must be done quickly to save a life. There is no time to find the chart or go through the patient's paperwork to see if they are a DNR or not. This makes the DNR stickers very important. I believe that we should have a checklist associated with DNR orders, and that is double-checked by another RN. The checklist would include applying the sticker to the patient's medical bracelet, putting the DNR status into the computer and onto the patient's flow sheet, and placing the DNR paperwork at the front of the paper chart. A second RN should then double-check that everything on the list was accomplished and sign the checklist. The checklist should go with the DNR form that is placed in the chart. When a DNR is rescinded, there should also be a checklist that includes changing the patient's wristband to one without a DNR sticker, entering the patient's new code status, which would then be full code, into the computer, and signing the DNR paperwork to show that it is rescinded. Again, a second nurse should have to sign this checklist, and the checklist should be placed with the rescinded DNR form in the chart. My aim is to have 0 wrongful resuscitations or deaths because of unknown code status within the first 6 months of implementing these checklists. My goal will be to have these checklists used 100% of the time. I will measure this by doing a chart check 3 times a week throughout my unit to check that the checklists are being used and that they are signed by 2 RNs. I will also do my own check by confirming the patient's code status in the computer chart, as well as checking the patient's wristband to ensure that the sticker is placed correctly. To measure if someone has died because the DNR was not known or was resuscitated when they had a DNR, we will have to use self-reporting by the RNs or doctors involved. According to the systemic review done by Thomason, Storson, Soflin, and Bertabo, safety checklists strengthen compliance with guidelines, improve human factors, and reduce the incidence of adverse events. My hope is to improve communication about a patient's DNR status through the use of these checklists. Of course, nurses should also communicate the code status of their patients during report, but if the patient, their electronic chart, and their paper chart are all marked appropriately with their code status, there should be no confusion for anyone involved in the patient's care. These checklists could help to ensure that patients' wishes are respected when it comes to DNR status. Thank you very much.